Good day. Thank you for joining us for today's news. If you find this helpful, please consider subscribing. We're here every day with calm, clear updates just for you.
This morning, many New Zealanders were startled by an urgent mobile alert, but for others it was either missing or repeated multiple times. The alert was triggered due to a major earthquake in Russia, which led to high tsunami risks along New Zealand's coasts. Emergency officials explained that the issue was a technical fault in the alert system. Two official alerts were sent on Wednesday afternoon and another on Thursday morning. The second alert was a reminder that the tsunami threat still exists, urging people to stay away from coastal areas. Some people reported receiving it at all. One listener strived, receiving the alert repeatedly, causing her phone battery to drain compulsively. The system uses a technology called cell broadcast, which sends messages through base stations in specific geographic areas. However, factors like the age of a device or signal strength can affect whether the alert is received. Emergency officials emphasized that the alert system is just one side. The challenges they are committed to keeping the public safe in emergencies, even if it means some people may find the alerts annoying. The incident highlights the importance of relying on multiple communication methods during crises.
In Rotorua, a 90-year-old man has been charged with abducting a 3-year-old girl from a daycare center. The incident, which occurred on March the 10th, has shocked the local community and raised serious concerns about child safety. The court has remanded him in custody until August the 14th, when the next hearing is scheduled. The charge carries a maximum sentence of 14 years. The name of the daycare has been permanently suppressed to protect the child's identity, emphasizing the need for swift justice and thorough investigations as the legal process continues. The community remains on edge, waiting for more information and resolution.
In a shocking discovery in Freemans Bay, Auckland, the body of a newborn baby was found in a wheelie bin on July the 1st. The incident has left the local community in shock, with police cordoning off the area and launching a thorough investigation. A 32-year-old woman appeared in court on Tuesday, charged with interfering with human remains. The case has raised serious questions about the circumstances surrounding the baby's death and the lack of closure for families affected by such tragic events. An autopsy is currently underway, and police are appealing for any information that might help with the ongoing investigation. This is not the first time such a heart-taken stag. The community is being urged to come forward with any information that could help bring justice for the baby and their family. As the investigation continues, the focus remains on uncovering the truth behind this tragic case and ensuring that no other family is left without answers.
A powerful earthquake off the coast of Russia has sent tsunami waves crashing into shores around the world, including New Zealand. Emergency FASEF. The H.8 magnitude tremor is one of the strongest ever recorded, and the threat is far from over. In some areas, the tide is adding to the danger, and ferry routes have been changed. Officials are working to fix a glitch in the alert system that caused some people to get multiple messages, while some countries are lifting warnings. The message is clear: stay alert, follow the guidance of local authorities, and remember that nature can be unpredictable. It's a sobering reminder that even the most distant quakes can turn into life-threatening events.
A powerful earthquake off Russia's Kamchatka Peninsula has triggered a tsunami warning that's still in effect along parts of New Zealand's coastline. Emergency officials are reminding residents to stay away from beaches and low-lying areas and are reminding residents to consider. Meanwhile, a technical glitch has caused some people to receive multiple emergency alerts, while others have gotten none at all. NEMA is working with phone companies to fix the issue. This rare event highlights the need for preparedness and reliable emergency systems as the situation unfolds. A first-year safety, with the combination of a massive earthquake and the potential for a tsunami. It's a reminder of nature's power and the importance of being ready for the unexpected.
New Zealand is making a big change in its health policy to protect its youngest citizens. Starting in September, the meningococcal B vaccine will be fully funded for all children under 5, regardless of whether they completed their initial immunizations. This move replaces the current catch-us to the life-saving Bexsero vaccine. Health officials say under 5s are the most vulnerable to meningococcal disease, and this expansion removes barriers for families. Making it easier to complete the vaccine course, the new policy is expected to benefit up to 77,000 children who may have missed earlier doses. While the focus is on younger children, teenagers and young adults in shared accommodation will still be eligible under current rules. This decision marks a significant step forward in protecting New Zealand's children and ensuring a healthier future for all.
In a major move that highlights the deepening security ties between the United States and New Zealand, the FBI has announced plans to open a new base in Wellington. This follows a recent surprise visit by FBI Director Kash Patelis, who emphasized the importance of collaboration with New Zealand as part of the Five Eyes intensive. The new Legate office will serve as a hub for joint investigations, intelligence sharing and capacity building, targeting threats such as cybercrime, terrorism, and organized crime. The FBI's presence in Wellington will expand to include partnerships across the Pacific region, including Samoa, Tonga, and the Cook Islands. New Zealand officials have welcomed the move, stating that it will enhance the safety and security of New Zealanders. Director Patel's visit also brought attention to his ongoing role in the controversy surrounding fruity tasty Tsunamis. As the FBI strengthens its presence in the region, it marks a new chapter in U.S. news history.
In a heartbreaking incident, a 2-month-old baby named Bellamere Arwen Duncan died after allegedly being given an adult dosage of phosphate at a Manawat pharmacy. This tragedy has sparked an urgent call for action from pharmacy owners across New Zealand, who are warning that the system is failing. The baby's death, attributed to phosphate toxicity, has led to an immediate joint review by the Ministry of Health and Health New Zealand, with MedSafe conducting an urgent assessment of the pharmacists, including Annabelle Turley, shortage, and the immense pressure on pharmacy staff, stating that the sector is on the brink of walk. They are calling for immediate measures such as a moratorium on new pharmacy licensing to presentory double checks. The incitation to so promptity, the incident has also prompted calls for a law change, emphasizing the need for systemic reform to ensure the safety and sustainability. As investigations continue, the voices of pharmacists and the families affected are growing louder, demanding bold steps from the government to address the crisis and protect public health.
A major strike by over 36,000 nurses, midwives, and healthcare workers across the country has left thousands of patient appointments and procedure postponed. The 24-hour Wako 8, the largest in recent memory, was a response to Grow campaign. Amadi Frahal can't have Pope, Wasak, the largest staffing health and CEO Dr. Dale Bramley praised the support from non-striking staff and volunteers, but also acknowledged the significant planning that went into managing the disruption. He emphasized that the organization remains committed to patient and staff safety and has seen a steady increase in nursing staff over the past 2 years. However, the strike has reignited the debate over healthcare staffing and the pressures on Philadelphia workers, with the outcome of ongoing negotiations being closely watched by the public and medical professionals alike.
In a controversial decision, Peter Richard Holmes, who was convicted of murdering Jamie Ellis in 2011, has been released from prison after 14 years. The New Zealand Parole Board ruled that Holmes no longer poses a risk to the combos. Jamie Ellis was lured away from a party and brutally beaten to death with a wheel brace. The incident occurred after a false accusation that Ellis had abused a woman at the party. Holmes was the lead attacker and was sentenced to life imprisonment in 2012. However, after years of rehabilitation, the parole board has determined that he is now at a low risk of reoffending. Holmes has been released to an undisclosed location and is now subject to a number of lifelong conditions, including a curfew, electronic monitoring, and a ban on alcohol and drugs. During his parole hearing, Holmes expressed remorse for his actions, admitting that he had acted out of righteous anger and a belief at the time that his actions were just off. The decision to release Holmes has drawn mixed reactions, with some questioning whether justice has been fully served in this tragic case.
That's all for today's news. We appreciate your time. If you enjoyed this update, please consider subscribing. Your support helps us keep going.